also allow us to free up resources that can be used for responding to other public health events that are equally important. That doesn't mean the pandemic is over, or that COVID-19 data is not important, or that there aren't continued risks. The resources that go into as much daily data as we're reporting can be better spent elsewhere at this stage. By elsewhere, I mean things like our broader respiratory virus response, managing the monkeypox outbreak, the work we're doing to eliminate health inequities, and better responding to other diseases. Starting next week, on Wednesday, September 14th, we'll shift from producing a COVID-19 data update to reporting cases weekly. We'll continue to publish a summary table with downloadable data, including county-level confirmed and presumptive cases, county-level COVID-19 related deaths, county-level COVID-19 tests, and state-level emergency department visits for the COVID-19-like illness. Most other COVID-19 dashboards, including the COVID-19 cases by zip code, vaccination dashboards, pediatric reports, and case demographics and disease severity, will be updated monthly on the second Wednesday of the month. We'll also shift our biweekly COVID-19 data report and the congregate care setting outbreak report from every other week to monthly, and our monthly breakthrough report will become a dashboard, still updated monthly. But as I said, this doesn't mean that the pandemic is over. We'll continue to publish a lot of COVID-19 data that you can use to make decisions about how best to keep you, your loved ones, and your communities safe. Now I'm going to hand it over to Dr. Seidlinger to provide an update on the status of the pandemic and the new updated bivalent booster. Dr. Seidlinger?
Thank you, Director Allen. Good morning, everyone. I'm Dr. Dean Seidlinger, Health Officer and State Epidemiologist at the Oregon Health Authority. Today, I'll be giving an update on the state's continued response to COVID-19 and providing more details on the COVID-19 vaccine boosters that Director Allen mentioned. Doses have already started arriving around the state at local public health authorities, federally qualified health centers, tribal clinics, healthcare providers, pharmacies, and OHA-run community clinics and high-volume vaccination sites. I will also provide an update on monkeypox, or HMPXV, which continues to spread in Oregon, the United States, and globally. First, I want to highlight the improving trends we're seeing with COVID-19 in Oregon. Since OHA's last update on August 17th, daily reported case counts have decreased from a rolling 7-day average of 817 cases reported August 17th to 495 reported September 6th. This continues to track the trends that the Centers for Disease Control and Prevention are reporting nationally. In Oregon, test positivity is dropping from 9.2% reported the week of August 21st to 8% reported the week of August 28th. As we continue to share in our monthly updates, the number of reported cases does not capture the full story. Many people are using at-home tests and the results are not reported to public health. Many others are also not testing. However, reported tests and wastewater monitoring around the state are showing slight declines, but still high levels of COVID-19 in our communities. OHA's partnership with communities statewide and Oregon State University to monitor COVID-19 transmission through wastewater surveillance shows Oregon saw its last peak in mid-July. On September 2nd, the CDC reported one of Oregon's 36 counties, Malheur, was at the CDC's high COVID-19 community level, indicating high levels of COVID-19 and increased stress on hospitals. On that day, the CDC reported that 28 counties recorded low community levels of COVID-19. Our data, current as of the end of August, also show continued Omicron subvariant BA.5 accounting for nearly all sequence samples. Now I want to highlight hospitalization numbers. Since our update on August 17th, the number of hospitalized patients with COVID-19 in Oregon continues to steadily decline from a peak in mid-July. As of today, the number of COVID-19 positive patients in hospitals is 269. The latest forecast from Oregon Health and Science University's modeling team, led by Dr. Peter Graven, published on September 2nd, reported that as of the start of September, Oregon has seen a 44% drop in COVID-19 positive hospitalized patients from the peak of 464 reached on July 17th. Dr. Graven's update also reported that only 6% of occupied ICU beds are filled with COVID-19 patients. COVID-19 positive patients in hospitals and in the ICU continue to be far below Delta and Omicron surges from this past summer and winter. However, hospitals are still seeing effects of patients with medical conditions possibly exacerbated by disruptions to care during the pandemic. Pressures on our healthcare workforce from COVID-19 remain an issue statewide. Some hospitals also cannot fully discharge some patients who may not need hospital-level care. OHA continues to be in close contact with hospital partners and the state legislature on proposals to support healthcare systems to address these challenges. Now I'd like to talk about the important news last week. The Food and Drug Administration, or FDA, and the CDC, followed by the Western States Scientific Safety Review Work Group, gave emergency use authorization to new Omicron targeting COVID-19 boosters for the fall. The decision means that more than 2.7 million Oregonians are now eligible to receive a booster dose. The approved Moderna bivalent booster is authorized for persons 18 and older, while the Pfizer booster can be given to persons 12 and older. Each can be provided to a person 2 or more months after completing a vaccine series, or at least 2 months after the most recent booster dose. People who are now eligible for a booster can also mix and match. It doesn't matter which original vaccine series, Pfizer, Moderna, Johnson & Johnson, or Novavax a person previously received. They can now get either of the 2 new boosters. As we head into the fall, as more of us spend time indoors, the updated booster will be the best way to protect ourselves and those around us from severe illness and hospitalization caused by the dominant BA.5 and BA.4 COVID-19 subvariants. The updated booster from either manufacturer is safe and effective at preventing severe illness, hospitalizations, and even death. The 2 boosters were developed using data from animal studies and informed by the large body of evidence that we now have on COVID-19 vaccines. The Pfizer and Moderna mRNA vaccines each went through extensive clinical trials before these companies updated their formulas for the bivalent booster. This is similar to how our seasonal flu vaccine gets updated every year and is used in the USA and around the world. The FDA and CDC also determined that the boosters are safe and effective when bundled with other vaccines, such as those for influenza and other diseases, including HMPXV or monkeypox. Both Moderna and Pfizer's updated boosters have an mRNA component that targets the BA.4 and BA.5 subvariants and an mRNA component that targets the original COVID-19 virus strain. In addition, no one who is now eligible for a booster needs to have had previous boosters to get the boosters. They are free, and no insurance or proof of residency is required. As of today, 69,400 shots have arrived in Oregon at states receiving state allocations like local public health partners, at federal sites like tribal health clinics, and at pharmacies. OHA expects to have 2 waves of orders to be delivered this week, or 75,500 doses. We also expect a similar number, another 75,500, to be delivered to pharmacies for a total of at least 150,000, which we believe is enough supply to meet initial demand. As shipments continue to arrive in Oregon this week, OHA is asking everyone seeking the new booster doses to be patient. There will be enough boosters for everyone this fall. And thank you to everyone who has already rolled up their sleeves to get a booster. OHA continues to encourage everyone who is interested in receiving the updated booster to check with their health care provider first to see when the booster will be available, or to check OHA's website and the Get Vaccinated Oregon tool. OHA also continues to offer vaccines at community clinics and high-volume sites. OHA is opening 3 new high-volume sites this week in Redmond, Medford, and Eugene, in addition to our existing high-volume sites and smaller clinics. And we are regularly updating information on expanded hours and sites on our news blog. Finally, with flu season upon us, OHA encourages everyone to get their annual flu shot and combine them with their boosters if they can schedule both at the same time. Again, it's safe to get both at the same time. Please check when you schedule your appointment to make sure your provider has both vaccines. Anyone 6 months and older is eligible to receive a flu shot. Remember that if you get COVID-19, highly effective treatments, including Paxlovid, are available to help prevent severe disease in those at greatest risk for complications. You can learn more about treatments and therapeutics on OHA's COVID-19 website. OHA continues to encourage anyone who may be at increased risk because of age or underlying health conditions to make a plan now for how and where you will get tested and receive treatment in case you get COVID-19. Those who don't have a healthcare provider can contact their local health center or call 211 for assistance. I would also like to take a few moments to provide an update on monkeypox or HMPXV in Oregon, including some new demographic data we have begun publishing this week, as well as our latest recommendations for monkeypox vaccines, the investigational antiviral drug tecovirimat, also known as TPOXX, and when and for whom we recommend testing. First, the latest monkeypox data. As of today, there are 179 presumptive and confirmed cases of monkeypox in Oregon, with illness onset ranging from June 7th through August 30th. The cases are in 8 counties, with 5 reported in Clackamas, 2 in Columbia, 1 in Coos, 21 in Lane, 2 in Marion, 127 in Multnomah, 20 in Washington, and 1 in Union. About 9.5% of cases identify as Mexican, and 8.9% of cases identify as other Hispanic or Latino, Latina, Latinx. Case counts for other South American and Central American residents were too low to calculate a percent. According to the Centers for Disease Control and Prevention, there are more than 20,700 cases across all 50 states, the District of Columbia, and Puerto Rico. These are among nearly 55,000 cases in 100 countries. My thoughts are with all of those people who became ill with this virus or know someone who has been infected. People often experience discomfort and severe pain, which can last for weeks. Starting today, OHA, in consultation with its Equity and Inclusion Division, as well as community partners, will begin monthly reporting of monkeypox case data by race, ethnicity, language, or disability, known as REAL-D, and sexual orientation or gender identity, or SOGI. In 2021, the Oregon legislature passed House Bill 3159, which charged OHA with drafting and adding SOGI questions to the current data collection standards in OHA Oregon administrative rules, building a data collection system for both REAL-D and SOGI, and developing and implementing reporting requirements. OHA and local public health partners have been collecting SOGI information from people diagnosed with monkeypox since the start of the outbreak in Oregon. By publishing REAL-D and SOGI data, we and our local public health and community partners can better understand the diversity of people living in Oregon, which helps us identify and address health disparities and support data justice in communities most affected by health disparities. While the narrative of monkeypox in the United States has centered on cisgender gay men as the population most affected by the virus, this narrative does not reflect the full spectrum of people who have been affected by monkeypox. Sexual orientation and gender identity data help illuminate the experiences of people with other gender identities and sexual orientations in Oregon's outbreak of monkeypox. This new monthly reporting of REAL-D and SOGI data supports data justice and OHA's strategic goal of eliminating health inequities by 2030. It is a reminder that data are not neutral or objective, but rather are products of unequal social relations. Having this context is essential for conducting accurate, ethical analyses and ensuring meaningful access to services for everyone in Oregon. Next, I'd like to touch briefly on monkeypox vaccines and antivirals. Oregon has distributed, or is in the process of distributing, more than 40,080 doses of the JYNNEOS vaccine and 263 courses of the investigational antiviral drug known as tecovirimat, or TPOXX, since June 20th. According to our Alert Immunization Information Systems database, 7,530 JYNNEOS doses have been administered so far. We know that more than that have been administered, but those 7,530 doses are what's already been entered into Alert. We continue to work with our partners to redistribute any leftover doses they may have to ensure a continued steady flow of vaccines to communities where they're most needed. As of today, Oregon has fewer than 5,310 doses left in stock. When I spoke to you in August, I shared that supplies of the JYNNEOS vaccine were, at that time, very limited. As a result, we are focusing on a vaccine approach that prioritized first doses and only recommended second doses 28 days after dose 1 for people most at risk for severe disease, so we could provide vaccine to as many people as possible as quickly as possible. I'm happy to report that our monkeypox vaccine availability continues to grow at a steady pace. We are adjusting our strategy and encouraging providers to begin administering second doses at the 28-day mark to patients who have already received their first dose of JYNNEOS. That means we are no longer asking people who had their first dose and are not high risk to hold off 2 to 3 months before getting their second dose. This is great news and speaks to the incredible work of local public health authorities, healthcare partners, and community-based organizations to stay nimble and efficient in getting the vaccine to those most at risk and in need. We appreciate everyone's patience during this challenging time. Part of this increased vaccine availability can be attributed to another new strategy, which is a shift to intradermal injections from the more traditional shots administered subcutaneously or in the tissue between the skin and the muscle. On August 9th, the FDA issued an emergency use authorization for intradermal injections of the JYNNEOS vaccine. This method, in which the vaccine is injected just under the skin in a similar way to how a tuberculosis test is administered, allows for more vaccine doses, as many as 5, to be drawn from each vial. A 2015 study showed that a smaller dose of the vaccine delivered intradermally produced the same antibody level as a larger dose delivered subcutaneously. We also are encouraging providers to consider treatment with TPOXX antiviral drug for people infected with monkeypox when they are first diagnosed to prevent complications, lessen symptoms, and potentially decrease risk for transmission, whether or not they have severe disease or are at risk for severe disease. And like the JYNNEOS vaccine, TPOXX is safe, well tolerated, and effective. Finally, testing. We are encouraging providers to test their adult patients for monkeypox, even if they only suspect the virus based on the patient's symptoms. Testing is available through multiple commercial laboratories, as well as the Oregon State Public Health Laboratory. If people want to find out how to access testing for vaccines and treatments and take additional steps to protect themselves or others, they can check out OHA's monkeypox website. We also continue to recommend people talk to their healthcare provider about monkeypox testing, particularly if they have symptoms they believe to be symptoms of monkeypox, even if they're not in a high-risk category, such as if they are pregnant or immunocompromised. Finally, thanks again to everyone in Oregon who continues to look after each other and their neighbors. As you start heading back indoors, all of us can still wear well-fitting masks in indoor settings to protect others and ourselves. For those at high risk, or people caring for or living with someone at high risk, wearing a mask in indoor public places provides extra protection. Wearing masks in areas statewide where we have higher COVID-19 transmission also helps to protect those around you. And with that, I'll open it up to questions from reporters.
Thank you, Dr. Seidlinger. Just a friendly reminder to please mute your audio and use the raise your hand function to be added to the queue, and I'll call on you to ask your question. Our first question comes from Amelia Templeton with OP.
Yeah, I have a couple questions about the bivalent boosters. People have been told that the original vaccine and boosters provide good protection against severe hospitalization and death, particularly if you have also had a COVID-19 infection. Can you explain what it is, what kind of protection you expect people to get from these new boosters? And in particular, should somebody who hasn't had a booster recently be concerned that that protection against severe illness and death is waning over time?
Thank you for that question. This is Dean Seidlinger. What we've seen over time is that protection from vaccinations, including boosters, does go down over time. So we see a higher risk of hospitalization and death in older individuals and those with underlying conditions in particular, the further they are out from their last dose of vaccination. This new bivalent booster dose continues to include the strain of virus that was included in the original vaccine. Plus, it adds additional information from the BA.4 and 5 variants that are currently circulating and will offer that individual increased protection. So if it's been 2 or more months since your last vaccination, completion of your primary series or your booster dose, getting a bivalent booster dose now will kind of rev your body's immune system up and allow it to continue to protect you from severe disease, will keep you out of the hospital and keep you from dying. So anyone who's 2 months out from that last dose should consider how they're going to get their bivalent booster dose in the coming weeks.
Amelia, you mentioned you had several questions. Go ahead if you wanted to ask another.
Yeah, just crunching the numbers, it looks like we have about, it looks like there's 2.7 million people you said are eligible. We have enough doses for about 5% of that. Is there anyone, you know, given, I guess, like, you know, if you expect sort of just 5% of eligible people to get this vaccine, how does that compare with, say, like the flu vaccine? Is that about the uptake that you'd expect, or is that low?
I think the flu vaccine uptake varies year to year, depending on kind of how severe flu is at the time that people are considering vaccination, what the previous flu season was like, and so that can vary. I certainly expect more than 5% of Oregonians will roll up their sleeve and get a bivalent booster dose. But we know that as vaccines are rolled out, you know, some individuals want to be first in line and get their vaccine as soon as it's available, and other people, you know, add on that vaccine, you know, in coming weeks. So, you know, if all of those 2.7 million people decide they want to be vaccinated in the next 2 weeks, you know, we would not be able to meet demand. But we anticipate, based on previous kind of rollouts, that, you know, we'll have a surge in people wanting the vaccine immediately as it becomes available, and these initial doses that arrived in the state should be able to meet that. And we expect continued weekly doses to be available so that people can get their vaccine in the coming weeks as those arrive in the state, and people can get those vaccines along with their flu shot if they schedule those at their providers or pharmacies, as flu shots are becoming more widely available across Oregon.
Thanks.
Thank you, Amelia. Thank you, Dr. Seidlinger. Our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thank you. I've got 2 questions. So does OHA plan to return to daily reporting if the surge that Peter Graven anticipates will come in the fall does indeed come?
I don't know that it would be that that predicted surge. That's a pretty modest surge compared to where we've been earlier in the pandemic. I would say that we, however, absolutely would return to daily data reporting if we get to a place where we think that daily information is useful for policymakers, for the public, to be able to you know, be nimble in the face of changing circumstances, which we don't anticipate at this time. But if that occurs, then we can make that change. Yeah.
Got it. Thank you. And with monkeypox, what do you has OHA developed models to develop projections of when that outbreak might peak, or how many actual cases there might be right now versus how many have been identified?
OHA does not currently have a model for looking at the projections from HMPXV, and we continue to have conversations with our federal partners who are working on modeling, but we don't yet have a formal model. What we're seeing in the data, though, is encouraging. The national numbers, which are driven primarily by the 2 states with the highest number of infections, New York and California, are starting to show decreases. Oregon's cases and outbreaks started after those states, and so we would anticipate to see a similar pattern. Survey data has shown that individuals at highest risk for HMPXV have started to change their behaviors. And we know that as vaccines become more available, people are rolling up their sleeves and receiving that protection. So, you know, I'm encouraged by the slowdown in increasing cases that we see this week, and hope that that trend will continue in the coming weeks, regardless of a model. I think looking at the other states and the national data can show us that hopefully we're nearing the worst of this, and we'll start to see a decline soon.
And those surveys, are those national surveys or Oregon-specific surveys?
Those were national surveys that were released by the Centers for Disease Control and Prevention, I think about a week and a half ago, 2 weeks ago, that asked people about changing behaviors, number of sex partners, and if they've changed the behavior in the face of HMPXV infection spreading.
Thank you.
Thank you for the question. Okay, our next question comes from Heather Roberts. Go ahead, Heather.
Good morning. I'm just looking for some more information on the high volume sites that you mentioned would be opening in Redmond, Medford, and Eugene. Can you tell us more about those, when they'll be opening, and why we're seeing a return of that type of response?
Thank you. I'll start with the latter part first. As the new bivalent boosters are available, and we know it opens up eligibility across even more Oregonians than we've seen in previous kind of vaccine changes, that we wanted to be prepared to have vaccines available to individuals in as convenient a way as possible, so that individuals who are seeking the vaccine can get those. Information on hours, including opening times, for those 3 new sites, as well as our continued sites, can be found on our website, and using the Get Vaccinated Oregon tool, people can identify those vaccine sites and get in to get their booster doses.
All right, our next question comes from Lynn Terry with the Oregon Capital Chronicle. Go ahead, Lynn.
Okay, I'm unmuted. Yeah, I'm just wondering, with this turn of focus away from data to other issues, how many people are we talking about that you're going to be able to, shift towards other things? What have you not been able to do, and what will you be able to do that Oregonians are going to see the impact of? I mean, what this new work, how is this going to affect Oregonians? How are they going to benefit? And how many people are we talking about?
Yeah, so several points there, Lynn. I don't know that I could quote you number of people exactly, and this is a little bit of both shifting focus. You're hearing time spent today on HMPXV, and people who've been involved in that effort have previously been pretty occupied with coronavirus over the course of the pandemic. It's also just sort of the natural attrition as the volume of work decreases with our coronavirus response unit. We're having people who are leaving that unit, moving to other functions, either within the health authority or public health or elsewhere. So we've got people who are involved in data visualizations, analytics, those kinds of things, who are shifting to other work. So I don't think you can sort of draw a one-to-one line and say these 5 people have stopped doing this and are now doing that. But the mix of work that we're doing is kind of reverting back to a more ordinary mix, modified by the focus that Dean talked about on eliminating health inequities, which is something that was work that we really weren't focusing on before the pandemic in the same way that we are now. So and then work like preparing for what we think is going to be a much more vigorous respiratory virus season with flu and RSV, and people who continue to be vulnerable in long-term care facilities and those kinds of things.
Do you think Oregonians are going to see an impact or not? This is just a sort of, internal shifting of the chairs or moving of the chairs or whatever.
Well, I hope people are going to see an impact. I hope people are going to see a better focus on health inequities and the impacts of racial injustice on the work that we do and the impacts that we have. I think one of the things I'm very proud of the work that we did was closing vaccine inequities for various population groups. African Americans overall in Oregon are now as vaccinated as the white population. That's not something we had been able to achieve before in any other area. And so I'm hopeful that as we begin to broaden our focus back to the full range of work that we do, that you'll be able to see more of those kinds of achievements and progress that we make.
Can I just ask one thing? I don't mean to hog this, but you mentioned a more vigorous respiratory season. Is that because most people aren't wearing masks and stuff, so you expect to see more people with flu, et cetera?
Yeah, Dr. Seidlinger is probably in a better position than me to answer that, but I think it's a combination of not having had those viruses around because of those protections and the fact that people aren't using the same protections. Doctor, do you want to talk to that?
Sure. Yeah, I think it's a combination of several things. So with wearing masks, keeping our distance, and some of the even more severe staying home behaviors that we saw early in the pandemic, influenza did not circulate in Oregon or other states nearly as vigorously in the past couple of seasons as it has previously. So we don't have as many people who've recovered in the previous flu season or the season before who have that level of immunity. So that puts more people at risk for influenza this season. And with many more people not wearing masks consistently in indoor public places, that also puts them at risk. That mask that protected us from COVID-19 protects us from influenza and RSV as well. With influenza and its seasonality, we do look to the Southern Hemisphere for how influenza circulates through their winter, which is our summer. And what we've seen, especially in Australia, is cases of influenza and hospitalizations from influenza have been much higher this season than they were in previous season. So that usually kind of helps us forecast what we could expect in Oregon and across the United States from influenza. Similar to kind of when we try to predict what's going to happen with COVID-19, we need to be humble when we try to predict what's going to happen with influenza because it can be very unpredictable. But those high rates of disease in the Southern Hemisphere, I think, indicate that we're in for a high level of disease here in Oregon. And that's why I encourage everyone to get their influenza vaccine and their COVID-19 booster. Those two things will offer you the best protection against severe disease and hospitalization from either of these diseases. And if you're at high risk for complications or live with someone who is, wearing a mask consistently, in indoor public places can cut down your risk even more. So I expect as we move into respiratory season, we'll see more masks come on to bases in Oregon.
Thanks.
Thank you for those questions. Our next question, I see, Amelia, you have a follow-up, but first we'll go to Colby with Central Oregon Daily News. Go ahead, Colby.
Thank you. I was just wondering, with these new boosters, what kind of side effects can people expect to experience? I know when I'm not sure if it was my booster or my second initial dose, I know I was kind of tired. I felt those flu-like symptoms for about a day. Can you still expect that with these boosters, or are people now kind of built up immunity from the previous shots they've gotten?
I think with these boosters, as with other boosters, we would expect similar side effects. So some people don't get any effects, with the exception of maybe a minor soreness at the arm where they got their vaccine. Others experience kind of a fever, feeling fatigued or sick, which lasts usually for less than 12 hours. Those side effects are probably going to be similar with the booster dose. The further you're out from your last dose of vaccine, maybe you'll have less of those symptoms, but expect similar symptoms to what you got with a previous booster if you had it, and they're self-limited and will go away. And it's much better than going through COVID-19 as an infection.
Thank you for that question and that answer, Dr. Seidlinger. Our next question comes from Lisa Balick with Coin 6. Go ahead.
Yes, good morning. Two questions. One, we keep calling around trying to find out when somebody's giving out the booster shots and haven't had much success yet. Do you have some sense as to when actually people can make those appointments and the door will be opened and people can get those going? Would it be today, tomorrow, by the end of the week? That's two questions, but let me give that one first. Thank you.
Yeah, I think Director Allen may be furiously searching the Get Vaccinated Oregon site. It looks like he was on a mission. But, vaccines began arriving at the end of last week. They were in fairly short supply initially, but now there are over 30,000 vaccines, in Oregon. A big part of that supply initially went to federal pharmacy partners. So pharmacies are a good place to check on the Get Vaccinated Oregon to find a pharmacy near you who might have it. Our community clinics run by OHA and our partners are beginning to get vaccine. And so those hours and locations will be on the Get Vaccinated Oregon tool. And then medical providers are starting to receive vaccines this week with a much larger volume coming in next week. So checking your provider's website or other ways that your healthcare provider communicates with you can be a good place to get an idea of if they have their vaccines in yet, and if you can make an appointment to get one.
And then follow-up question is, obviously, everyone knows you can't time a surge with that being estimated perhaps coming sometime in November. There's still a lot of people who are trying to time it in the sense of protection wanes. Now, if you're not in a high-risk group, you're not, let's say, over 60, 65, those who want more protection likely late in the fall when everybody goes indoors, do you support the reasoning that if you're not in one of these high-risk groups, that it's okay to wait a bit?
I think the further you're out from your most recent vaccination, whether primary series or booster, or the further you're out from recovering from COVID-19, your protection does start to go down. And while we've seen the kind of rate of spread go down significantly over the past, couple of months in Oregon, there's still a fair amount of disease out there. So, if you're more than 2 months from your last vaccine dose, getting a dose, your booster now will offer you protection for what's currently spreading as you go about, and should continue to offer protection against severe disease and death as we head into the fall and winter. What we've seen is the impact on waning immunity in preventing hospitalizations is seen most profoundly in the oldest Oregonians and those with underlying conditions who are most at risk for severe disease. So it's really important that they stay up to date with recommended vaccination doses to keep that protection strong. For other folks, that waning doesn't seem to lead to an increase in hospitalizations as much. So getting your booster dose now, if you're eligible, should provide you protection into the fall and as we go into the winter.
And just back on the booster question, Dean was right. I was on a mission, though it was not quite where he thought I was on it too. I just checked my local Safeway. I can get appointments starting on Monday for the updated booster. I don't know if that means that they have appointments, but they're full between now and Monday. But if you're in Sherwood, starting at 12:30 on Monday morning through 5, you can get boosters there.
We appreciate Lynn Terry's comment in the chat where several pharmacies have online vaccination signups as well, as you mentioned. So Walgreens, CVS, etc. All right, so it looks like our final question comes from OPB. It's a follow-up question from Amelia Templeton. This is our last question. Go ahead, Amelia. Thanks.
Yeah, just quickly, is there online anywhere a list of all of the high volume sites that OHA is supporting? You mentioned the 3 new ones. Is there a full list somewhere?
Yeah, if you if they're not updated now, if you go to the OHA COVID-19 page and click on the vaccine information, that'll get you a list to the Get Vaccinated Oregon tool, which will list kind of all appointments near you. And I believe we are updating our high volume vaccination sites there. I have a link to the posts that have information on our high volume sites.
And is there any in the Portland metro area?
We continue to offer the same vaccination sites that we've had available. We have one in Wood Village, and I believe there may be one other one, but we can't get you that complete information, Amelia.
And then on the bivalent boosters, do you have any specific advice for parents who are trying to decide whether to get a booster for a 12 to 18-year-old, given that there's kind of a different risk-benefit calculation for younger people?
Yeah, I think, what we've seen from vaccines is they do continue to offer protection against severe disease and death. When we talk about children, pediatric cases, the complication rates are much lower. But I think we have to put that into context with other pediatric diseases. COVID-19 has been one of the leading causes of death for children in this country over the last couple of years. So it does cause severe disease and tragedy that impacts, several families each year. With COVID-19 still circulating fairly widely and expected to increase as we move into the fall, with schools being a place with, a lot of people coming together for many hours each day, several days a week, the spread of COVID-19 can happen in schools. and having, a booster dose to increase protection against disease is the best protection that a child can have to keep themselves out of the hospital and from dying. There is a risk of side effects that is higher with inflammation of the heart muscle and the fluid around the heart after vaccinations in young adult males and adolescent boys. But with the level of circulating disease, the risk of myocarditis or inflammation around the heart from getting COVID itself is likely higher for that population than the side effects of the vaccine. So I'd encourage parents who have questions about vaccine and timing to talk to their healthcare provider about what's best for their child. But overall, the benefits from the vaccine will help everyone 12 and older protect themselves from being hospitalized or dying from COVID-19. With that, I think Erica said that was our last question. So I want to thank, all of our media partners on this call for helping us to get the word out. I want to thank all Oregonians for the continued steps you're taking to look after each other. Getting yourself vaccinated offers you protection as well as your loved one and family members around you. Together, Oregonians have saved thousands of lives from COVID-19 by the steps we've taken around changing our behavior, wearing masks, and getting vaccinated. Oregonians, particularly members of the gay, bisexual, and queer community who've been most impacted by HMPXV have also stepped up, rolled up their sleeves, and gotten their HMPXV vaccine to offer themselves protection as well as protection to their friends, neighbors, and family members. I'm continually impressed by the sacrifices Oregonians have made to protect each other and humbled by the lives that have been saved by the actions you've taken. I know people are still sick with COVID-19, are still sick with HMPXV. People are preparing meals, supporting loved ones, neighbors as they recover. And I hope that Oregonians will continue those behaviors as we continue to face these two diseases, but in a much more manageable fashion than we have over much of the last 2.5 years in terms of COVID and over the last 2 months as we have with HMPXV. So thank you.
Thanks, everyone. The YouTube live stream has ended. I don't know if you'd want to do a debrief after all the press has left the room. I will keep this meeting open.
Recording stopped.